Welcome to the Bone Clinic. My name is Dr. Belinda Beck and I'm a co-director of the clinic. We've developed a video to show you what you can expect at this and future visits to the Bone Clinic. The Bone Clinic is not your normal health service. We provide a unique service of comprehensive care to people with conditions affecting bone, including osteoporosis and osteopenia. We are fundamentally evidence-based and research-focused, so you know you'll be receiving the best possible care. Please feel free to ask us questions at any stage of the process. The first person you'll meet when you come to the Bone Clinic is our receptionist, and she'll give you some forms to fill out, which include some surveys and questionnaires, which are a really important part of your journey through the Bone Clinic from the first time you come to the very last. The next person that you meet at the Bone Clinic will be the Dexa Technologist. And she'll take you through to the Dexa room, where you'll experience a whole body scan, a lumbar spine scan, and a hip scan. And those are the basic scans that tell us about your bone health. The next person that you'll see is the exercise physiologist, and they'll perform your baseline assessment, which are a series of functional tests which tell us a little bit about your risk of falling, which in turn tells us about your risk of fracture. The next person you'll see at the Bone Clinic is the dietitian. We have a highly experienced dietitian who knows a lot about the effect of calcium, vitamin D and bone. She can analyse your diet comprehensively, but she has a specific focus on whether you are eating adequate amount of calcium and strategies to bring your calcium levels up to the recommended daily allowance.
So for clients who are at high risk of falling or have had major injuries such as hip implants or even recent fractures, at your second visit you're assessed even further to determine what entry level of exercise class you can go into. It could either be the beginners classes or it might even be the clinical exercise class. We have different services in different places. So, you have the Dexa scan over here and you have the exercise physiologist over here, you have the dietitian, the doctors, and we really just wanted to bring it all into the one building and provide an aggregation of services that anyone with osteoporosis or other bone conditions just visited one place in the one building.
Sometimes people ask us why they can't just come to the Bone Clinic and start training without all of these tests. The reality is we are fundamentally a research clinic, and our goal is to improve our practices to maximise your bone health and the health of other people who attend. If you don't have our baseline scans, we have no way of following up your progress, so they are absolutely imperative to our practice. As a research facility, the Bone Clinic has a Memorandum of Understanding with Griffith University. We continue to perform research on a daily basis at the Bone Clinic, and we also provide a facility where Griffith University students can come and undergo exercise physiology placement training to prepare them for their future careers. We have hundreds of clients now training with us, and so we anticipate when we analyse all of their results and publish our findings that the clinical community will be convinced that training with targeted exercise, as we do at the Bone Clinic, is how to manage osteoporosis into the future.